Good morning, witches and wizards, and welcome to Charms class. Now today, we'll be learning the dual spell of Wingardium Levodopa and Wingardium Carbidopa. And these two spells, when cast together, create a spell by the trade name of Cinnamette. So first we will learn about the history of the spells, and then we'll get into practice casting it. So first, the method of action of Wingardium Levodopa. This spell works by first entering the body. It is then able to cross the blood-brain barrier. Once it's crossed the blood-brain barrier, it's able to travel into the nerve terminals, where the levodopa is then converted to dopamine. Once it's converted to dopamine, it can be transferred to the synaptic terminals where it binds to dopamine receptors. Once bound to dopamine receptors, it's able to do all the normal activities that dopamine would do in the body. Now, why dopamine, you ask? So one of the biggest indications of this spell is to help treat Parkinson's disease. Now, Parkinson's disease is the overall balance of dopamine and acetylcholine within the body. So usually in Parkinson's, there is a decrease in the dopamine in the body and an increase in acetylcholine. And when this happens, it can show symptoms such as rigidity, tremors, and bradykinesis. Now, there are several witches and wizards who are at risk for developing Parkinson's disease, and those include aging, some environmental factors, some witches and wizards are predisposed to Parkinson's disease, and some toxic agents can contribute to the development. Now, these risks, when at the right time, fluctuate, can form free radicals and oxidant stress, and when these happen, this can lead to a loss of overall dopamine within the body. And this loss of dopamine, in turn, as said before, shows the symptoms of rigidity, tremors, and bradykinesis. The second spell that we are learning today is Wingardium Carbidopa. So the method of action of this spell is that it can't be used by itself. It has no therapeutic effect on the body. Its main use is to be used alongside Wingardium Levodopa in order to help its activity. So what Wingardium Carbidopa does is it blocks the destruction of levodopa within the body. So normally, only about 2% of levodopa reaches the brain. Now, when you add Wingardium Levodopa to the spell, it allows for less of the levodopa to be broken down, and therefore the levodopa can remain in the body and have an increased therapeutic effect on the body itself. So overall, levodopa and carbidopa together can help reduce the signs and symptoms of Parkinson's disease. Now, you can cast this spell by first aiming for the mouth. It is best ingested orally. Now, how much of the spell and how much power to cast with it, there are two different tablets to give. One is a 25 milligram carbidopa to 100 milligram levodopa tablet. The second is a 50 milligram carbidopa tablet to 200 milligram carbidopa tablet. These are the main ways for the spell to be cast and have its effect on the body. As with any spell, there are several side effects and adverse effects that can come with it. Some side effects are nausea, vomiting, dyskinesia, postural hypotension, psychosis, and dark urine. Some adverse effects are edema, agitation, and ataxia. It also needs to be careful when casting on those witches that are pregnant. So, Wingardium Levodopa and Wingardium Carbidopa are considered a Category C pregnancy spell. So, you want to use extreme caution when giving this spell to witches in general. You only want to cast the spell when the benefits of the spell outweighs the adverse effects. In addition, Wingardium Levodopa Carbidopa also inhibits lactation, so that needs to be kept in mind when casting this spell as well. Now there are some wizard implications when casting this spell as well. You want to tell your witches and wizards to avoid a high protein diet. You also don't want to use this in witches or wizards that have glaucoma, melanoma, diabetes, peptic ulcers, or any form of cardio or pulmonary diseases. You also don't want to use this with MAOIs because it can cause some adverse spells and interactions. You also want to check your blood pressure when casting this spell because it can lead to postural hypertension. So you want to make sure that the blood pressure doesn't drop too much after giving this spell. And lastly, you want to look for a therapeutic response. So this spell is so good at doing what it does that if you don't see any therapeutic effects from it, you want to reconsider your diagnosis of Parkinson's disease in the first place. And lastly, some wizard education. So this spell can come with daytime sleepiness. You also want to be mindful when driving due to the daytime sleepiness and due to you not knowing the adverse effects of this spell. You want to be careful when operating vehicles such as cars or other trucks. The effects of this spell may take weeks or months to take effect, so you want to be patient when casting these spells and knowing that it might take a little while for you to see the results that you want. And lastly, you want to follow the guidelines of the spell itself. Make sure that you're giving the right dose and the right power of the spell, and to make sure that you're taking the right spell in the first place. Alright, witches and wizards, let's get ready to cast our spell.